Hello to all dear students. In this video, we'll be discussing about dose adjustment for uremic patients. Dose adjustment for drugs in uremic or renally impaired patients should be made in accordance with changes in pharmacokinetics and pharmacodynamics of drugs in the individual patient. Whether renal impairment will alter pharmacokinetics of the drug enough to justify dosage adjustment is an important consideration. For many drugs that are eliminated primarily by metabolism or by biliary secretion, uremia may not alter pharmacokinetics sufficiently to warrant dosage adjustment. Not only drugs but even their active metabolites must be considered for additional pharmacological effects when adjusting dose of drugs. For some drugs, the free drug concentration may need to be considered due to decrease or altered protein binding in uremia. Even combination products that contains two or more active drugs in a fixed dose combination may be differentially affected by decreased renal function, and thus use of combinational drug products in uremic patients should be discouraged. Next we'll talk about basis of dose adjustment in uremia. So we know we have a loading dose and a maintenance dose. Regarding loading dose, the loading drug dose is mainly based upon the apparent volume of distribution of drugs in the patients. It is generally assumed that the apparent volume of distribution is not altered significantly in uremia, and therefore loading dose of drug is same in uremic patient as in subjects with normal renal function. Whereas in case of maintenance dose, this maintenance dose is mainly based upon the clearance of drug in the patients. In uremic patient, the rate of renal drug excretion has decreased and leading to decrease in the total body clearance. Hence, it requires dose adjustment. So most of the dose adjustment assumes that non-renal drug clearance are unchanged. The fraction of normal renal function remaining in uremic patient is estimated by clearance, that is creatinine clearance method, and after remaining total body clearance in uremic patient is estimated, a dosage regimen may be developed by decreasing the maintenance dose or by increasing the dosage interval or by changing both maintenance dose and the dosage interval. So dose adjustment can be done by using either total body clearance method or by using elimination half-life method. Although total body clearance is more accurate index for drug dosing, the elimination half-life of the drug is more commonly used for dose adjustment because of its convenience. The clearance allows for prediction of steady state concentration, while elimination half-life method yields information on the time it takes to reach the steady state concentration. Next important thing is regarding the nomograms. These nomograms are charts available for used in estimating dosage regimen in uremic patients. The nomograms may be based on serum creatinine concentration, next upon the patient's data such as height, weight, age, gender and so on and so forth, and upon the pharmacokinetics of the drug. And one thing that you should remember is nomograms has errors in its assumptions and drug databases. Now first of all, we'll try to understand about how to use these nomograms. Now see, in uremia what happens? Uremia is a renal disease, so renal excretion is affected, and so it is assumed that non-renal elimination of drug is not affected by renal impairment. So we have got KNR. KNR means non-renal elimination rate constant, which is not affected in renal impairment, whereas KR means renal elimination rate constant, and this is basically affected in renal impairment. Next, this KR, that is renal elimination rate constant in uremic patient, is directly proportional to the product of a constant and creatinine clearance.